A very hearty welcome to all the speakers and the attendees. On the behalf of Voice of Healthcare and Walters Kluwer, I would like to welcome both our guest speakers and the attendees for this webinar. The topic of this discussion is role of CDSS in managing post-COVID complications. And the expert speakers for this session are Dr. Atul Gogia. Sir is the Senior Consultant Medicine, Infectious Disease Specialist at Sir Gangaram Hospital, New Delhi. And we have Dr. Vikas Deswal. Sir is the Consultant Internal Medicine Infectious Disease Specialist at Medanta, the Medicity, Gurugram. While sharing his expert views, Dr. Vikas will also be leading this conversation. And also towards the end, our speakers will be taking all the live questions all together. So without any further ado, I'll just hand it over to Dr. Vikas to start with this interaction. Over to you, sir.
Thank you. So a very good evening to everyone. So today we'll be discussing what is the role of CDSS in post-COVID management. And as rightly introduced by Khushbu, we have a very eminent speaker to discuss on that issue, and that is Dr. Atul Gogia. Dr. Atul Gogia needs no introduction. He's a very senior colleague, not just a very senior colleague, but a very humble man also. And without wasting much time, I would like to start the discussion for today. As we all know, we are in the COVID era now. We have just moved out of COVID era, and we had a very significant morbidity and mortality associated due to COVID in the second wave, which just got over a few months back. And after that, we had truckloads of mucormycosis and secondary complications due to dengue. So building up on that only, my first question to Dr. Atul would be, what are the post-COVID complications? What are the common ones, and how do we go about managing them?
Thank you, Dr. Vikas. Well, a very good evening to everyone. Dr. Vikas is always kind in the use of your words. Thank you. I would like to thank VOH and Khushbu for having us all together and discussing a thing which is very, very relevant in current times. Post-COVID complications, use of CDSS, and all these things, in the recent times, in the last couple of years, a lot of water has flown, and we've learned a whole lot of things, what is there. And if you talk about COVID, everybody, if all the, non-medical people actually, I think, were much more aware of what's happening, because they were actually more on the social media and they were able to get what's happening, because most of the doctors were there managing patients, so it was difficult for them to keep up. So with the literature, but things like CDSS helped the doctors in these trying times. First of all, going on to post-COVID complications. So if you see, anything and everything which is happening after COVID is labeled as post-COVID complication, unless and until you are able to find an absolute cause for it. So we are seeing a whole lot of things. And all my colleagues who have managed COVID and post-COVID patients would vouch for this, that every possible thing which we are seeing, right from common symptoms like fatigue, lethargy, lack of taste, lack of smell, breathlessness, low-grade fever, lack of energy, stress, anxiety, palpitations, the common ones which are there, which are seen in most of the patients. Most of the papers from China, America, and India would support all these common complications which are there, apart from rarer complications like cardiac events, stroke, thrombotic events happening thereafter, also after a month or two of, and things like post-long COVID terminology, where the symptomatology is persisting beyond 2 months and going on. Apart from the non-infective symptomatology which patients are suffering from, there are infective pathology, as Dr. Vikas rightly highlighted. There was a surge of mucormycosis and other lesser known infections like CMV and all, which was most commonly seen in post-COVID patients, partially because of the immune suppression, because of the severely ill patients, and along with that, use of a lot of immune modulation, whether it was steroids or other immune modulatory drugs which were being used in severe COVID. So we got to encounter a lot of infections also beyond the 1 to 2 month period because of these things. So it was a plethora from non-infective, infective, to physical, to mental, to terminologies being coming in and patients walking in with brain fogging. So there was a whole lot of thing happening. So we saw all this.
Yeah, absolutely, Dr. Atul. I completely agree with you. It was not just related to the infectious spectrum of post-COVID complications. We saw a whole lot of other things, and which included both physical and mental health issues in a majority of the patients. And subsequently, some days later, WHO came up with the definition of long COVID syndrome, as you rightly pointed out. And also, as you rightly pointed out, that there were multitude of problems ranging anywhere from mental health to chronic respiratory failure to fatigue, lethargy, and vague symptoms, and many of them even presented 2 months later with an pulmonary embolism or a stroke. So those were very unusual things which were seen in post-COVID era. Along with that, there was a lot of opportunistic infection. Why I'm saying opportunistic infection? Because majority of these infection you would invariably see in an immunocompromised host, that is those who had a organ transplant or a bone marrow transplant, or those who are undergoing cancer chemotherapy, or those who have a hematological malignancy. Usually you would associate these kind of problems, as Dr. Atul described, like CMV and mucormycosis, with these subset of patients. However, there was a new immunosuppressive which we can call as a post-COVID immunosuppression because of the use of steroids and other immunomodulators like tocilizumab in the treatment of COVID-19. So all those things we had seen. So there were a lot of infections like TB, CMV, mucormycosis, aspergillosis, few nocardia also I had seen. There was a spectrum of mental health issues ranging from psychosis to bipolar disorders to mania episodes in a few patients. Then there were a lot of other physical problems for which we could not define a term, or for which we could not have a definitive diagnosis. Like people would just complain of lethargy, fatigue, not feeling okay or not feeling 100%. And there was a study which actually showed that there were 18% of the patients had actually not reached their normal self even after 2 months of recovery from the COVID-19. So we saw a whole lot of problems, and that is where since these problems were ranging from multiple issues, from physical to mental to infectious to cardiac to cardioembolic. So we need a definite way forward, and we need a systematic approach to diagnose and manage these complications. And I think that is where the role of CDSS comes in. So taking the discussion forward, my next question would be, what actually is the role of CDSS in managing these post-COVID complications?
Yeah, so very well covered, Dr. Vikas, you highlighted. The only one thing which was left out before we take the second question was unearthing of diabetes in a whole lot of patients. Anyways, just wanted to finish off that. Yeah. Now come to the role of CDSS. If you see, CDSS has been there for long. It's been useful in a whole lot of medical problems, whether it is a cardiac, hypertension, infections. With the COVID scenario where everything went on virtual, the way we are having a virtual meeting right now. So before COVID times, none of us were well versed with using these kind of platforms, whether it is Zoom or any platform. We were all hesitant to use digital platforms. We were not sure how safe they were and how useful they were. But now, if you see the digital platform, whether it is the school children to the people working in companies or doctors, everybody is online and using the virtual platform. In similar fashion, we have seen the usage of digital prescriptions, online prescriptions. And if you see, all of us would agree that there is a huge increase and comfort level among the medical practitioners as well as the patients. Still 6 months down, we are after the second wave. Still, the patients are comfortable showing us online, which has become a boon from them because patients were traveling whole lot of distance to come to a tertiary care center from different states. So similarly, CDSS, where you can integrate the patients. So if you have a patient who was showing you for COVID, during COVID, and thereafter he or she is following up with you, so CDSS helps you in various ways. So what one is, by you having their digital record, you have the availability of what form of COVID these patients were suffering, whether it was a mild, moderate, severe, and thereafter what kind of complications. So you can have your own data. You do not have to look at the Western data, or it's become much more easier to publish scientific data with the use of things like CDSS, where you have your own data, where you see most of the patients were following up 500, 1,000, 2,000 patients because of the numbers were huge. So you know that how many of them had complications, how many of them did well, how many of them were having long COVID. All this can be easily assessed. That's one as far as scientific progression goes. As far as the patient health goes, there were so many patients who were actually not your primary patients, or most of them were like you never seen them before. So they were having a whole lot of comorbid illnesses. So you are not sure what medication they were on. So when you were prescribing them certain medications, or once they were hospitalized and they come forward to you for post-COVID complications, they were on plethora of other drugs for their comorbid illnesses. So those drugs, and whether it is an anti-diabetic, whether it is an antihypertensive, or whether it is an anti-TB drug or an antiviral drug. So there are a lot of drug interactions happening, especially so because a lot of these patients were on antifungals like voriconazole, or patients who are already on protease inhibitors. So there are a lot of interactions. So these systems help you in coming to know whether the drug interaction is there, what drug to use. So it will flag you what kind of a drug interaction is there. Thereafter, so these are the two main things where the main usage is. And again, you can also come to know whether there was an underlying illness, whether some patients who were having underlying respiratory illnesses and they had an exacerbation because of the post-COVID, then certain symptomatology, which is going beyond 4 to 6 weeks or 8 weeks, and with use of systems like CDS, you are able to flag out that something is amiss. Then systems like up to date and these kind of information, because there was so much information flowing in, none of us was aware to start with. When I started managing these patients in March 2020, we were hardly aware of what the disease was, how it is spreading, how do we treat, what are the complications. But as we had data coming in initially from China and the US, so there was so much data coming in. Social media was full of papers. So with systems like CDSS, you could screen the right amount of data, because on the move, you could see the kind of data which was available, what are the updated guidelines happening. So that way you could do appropriate scientific treatment for these patients and help them in getting them, and also counsel them that these, like we highlighted, that all across the world, patients are having post-COVID complication, patients are having long COVID. So it is nothing, we are not different. We may be different to some extent, but everybody is suffering. So with information coming in from across the globe, we can be more confident in addressing these issues. We ourselves feel confident, and we can transfer that confidence onto our patients and tell them that this is what it is. And that way we can instill confidence in them that you will be fine, or this is much time is this going to take. So these are the things which, actually help. These kind of things help in this kind of a scenario, which is totally new to all of us.
Absolutely agree, Dr. Atul, with what all you have said, especially to the point, to the fact that when we started managing these patients in March 2020, we were not aware of much about the information about this disease. It was a very new disease, and we, unfortunately, India, the pandemic started pretty early compared to many other countries. So we were fighting it much before many other countries, and as the disease progressed, as the time progressed, we sort of gathered information, and with the use of systems like CDSS, it helped us to manage our patients in a much better way. And also, I'm a big fan of checking drug interactions, which is very important in managing these patients when they are on multiple drugs. The first and foremost drug interaction which I remember and which is still in my mind is the interaction between the remdesivir and HCQS, when both of them were sort of part of armamentarium of managing COVID-19 in way back in May, June, July 2020. Although none of them have a very significant role in the current scenario, but remdesivir and HCQS use together was contraindicated, and that was very important drug interaction at that point. So drug interaction plays a very significant role in managing these patients who have multiple problems, like those with diabetes, hypertensive. They are on tons and tons of drugs already, and when you give them new drugs, you are always worried whether some of these drugs would interact with the existing drugs. So for example, I would just give you an example before we move forward. I am consulting on a patient who already had a pulmonary tuberculosis, then he developed COVID, and then after that, during the management of COVID, he was given a truckload of steroids. He did not need them in first point, but he was given. After that, he developed a pulmonary mucormycosis to go along with that. Now he is on rifampicin as well as posaconazole, which is like a very critical interaction according to me, because rifampicin, being an enzyme inducer, would reduce the levels of posaconazole by 66%, and there would be hardly any levels. So this is where the role of CDSS actually comes in, and it helps us in guiding that there is a significant interaction, and we should avoid using these two drugs together, and we should look for alternates. So that is where these systematic approaches help us in managing our patients in a much better way. So there's a very important question one of the audience, Mr. Chaitanya Kumar, has asked. He's asking, has CDSS helped in patient treatment during COVID time when the burden of patient was very high in ER and critical care department? And he is referencing it to the second wave.
Yeah, as we discussed rightly, so that the second wave was really humongous. There were thousands and thousands of patients. It was actually really a big task for the healthcare providers to manage a huge kind of patients. And by the time we had the second wave, we had a lot of information which was available as to the use of drugs, as rightly highlighted by Dr. Vikas. Initially, there were usage of HCQS and things. By the time the second wave came in, that was a year down. So we had a lot of information. We had the trial in place that dexamethasone helps in the severely ill patients on oxygen. So these systems provided us with good scientific evidence that these are the drugs which are available, which have evidence, which we could use, rather than just relying on simple information from social media. We could have reliable information. Then again, in the second wave, we had this issue, whole lot of issue of mucormycosis coming in immediately during that phase. So drug interactions, again, as highlighted, was a big information which we could gather. So
yeah, so Dr. Atul,
yeah.
carry on.
Yeah. Please carry on, Dr. Vikas. I'm done.
Yeah, as time went on, as the pandemic progressed, and more evidence was generated by the various RCTs across the world, and the guidelines keep changing from day to day by IDSA, by CDC, by WHO. So there was a whole lot of new information which was flowing in every day, and it was very difficult to keep update with all the information which is coming in, and it is also very difficult to believe which one to believe and which one to leave out, because there were a lot of articles which were written by even the eminent doctors in the newspapers, but many of them actually did not have the scientific backing. So since that was kind of an expert opinion, and expert opinion also has some weightage when you have a new disease and when you have a disease for which you don't have much information. So a lot of people were actually very excited about those articles on in the newsprint and in the electronic media also. But CDSS was one thing which provided us with an correct scientific information, and you can actually filter out which one you want to read and which one you want to follow, and what is the guidelines which are recommended across the world. So this helped us in a significant way in managing these patients in much better way. One of the audience wants to, Dr. Hemant wants to ask, can the tools like CDSS and health informatics be used to manage pandemics in future?
Yeah, I hope we don't have any pandemics in our lifetime, and I don't think so we'll have one. It's once in 100 years. But anyways, we should be prepared of these kind of things. And I think this pandemic has taught us a whole lot of new things, and how to go virtual, how to use electronic health records, and how to use tools like CDSS. And I'm very, very sure and confident with this kind of learning, we would be better equipped in and updating these kind of systems. And more, actually, it's not about development, it's about acceptance among our colleagues. So I think more and more people would be acceptable to this kind of these kind of tools here on. A lot of our senior colleagues were very hesitant of using the digital platforms and digital information. But now is the time when everything is available at a click. You ask your trainees a question, they would not think, they just would, look for an article and find out the answer there and then. So the similar way, the CDSS is going to be, that is the way forward probably, and that is the way things are going to be. So these kind of pandemics, these kind of tools would make us better prepared and make us manage these kind of things in a better fashion.
Yeah, I would completely agree with Dr. Atul, because these tools would definitely be of much help whenever we are facing these kind of pandemics in future. And I would disagree a little bit with Dr. Atul here, because we are in a field, Dr. Atul, where we have a new disease coming up every 10 years. We had an influenza pandemic in 2009, dengue epidemic in Delhi NCR in 15-16, and now the COVID pandemic. So every 5-10 years, this is the beauty of our field of infectious disease, where you have a new disease to tackle with. So these new kind of disease would keep coming every 5-10 years, and this is where the role of these kind of platforms and these kind of digital things, where they would help us in managing these pandemics in a much better way. And I'm sure as the time goes on, these systems would also refine themselves to a much better extent. So the next question is, are you seeing any change in approach from both your colleagues and administration in times of pre-COVID to post-COVID now?
Yes, definitely. There is a marked change in the thought process of the healthcare professionals, whether it is the health providers or the health staff which is there in the administration. More and more awareness, and even your senior colleagues or senior administrators who were not well versed with technology or usage of systems like HIS and the CDSS, they are more pro this after this. During the pandemic period, also during this first wave, there was a lot of learning process and a lot of inputs coming in from our senior colleagues, and they were pushing us and people junior to me to come up with innovations in which we can, use these kind of platforms, get the health records in place, get discharge summaries on time for these patients. Because so there is a lot of, they also now understand the health providers, and most of the newer hospitals which are coming up, so-called relatively newer, which have come up in the last 5 to 10 years, more and more of them are using purely digital platforms for writing their notes, getting electronic health records, using platforms like CDSS. Everything is virtual. So there is a lot of change happening, and the older hospitals like ours are also upgrading towards more and more the digital form and use of CDSS and things like that. So yes, that's the way people are now getting aware and using it.
Yeah, yeah, that is a very important point, that even that not so tech friendly or the tech illiterate is what we call all ourselves, have now sort of gradually moved to the tech age, and now we are much more comfortable using all these platforms, using doing online consultation, writing notes online. I remember a few years back when I was crossing I had gone to discuss an MRI in the radiology department, and the radiology colleagues were using dictaphone at that point to type the reports. So I was sort of laughing on them. What is this shit all about? Why can't you just type it straight away? You're speaking and then you're correcting it. It is double the work. So when the COVID pandemic started in March 2020, and when we started managing these cases, there was nobody to go with us on rounds, and nobody was there to write notes for us. So all of us were on our own, and we were sometimes rounding on 60, 70, 80 patients in a day, and writing notes for all of them was a very difficult job, and nobody was there to help us. So that's when I recollected that why can't we use the dictaphone. So that was arranged, and after that I started writing notes on that, and that was my first brush with using a digital kind of a thing in writing notes, and all that was possible. That innovation was possible because of COVID only. Otherwise I would have never used that in my life. So yeah, we have seen a lot of digitalization, a lot of change in how we see our patients, how we manage our patients. Now I'm very comfortable consulting a patient online. Earlier, I would always push that you should come to the clinic directly, or you should come to the hospital. I would like to examine and all those things. But once I have seen a patient in a clinic, we have reached a diagnosis, and a fairly reasonable plan has been made. I am fairly comfortable following him online now. Earlier, that was not the case. So actually, that is much more comfortable for the patient also. He can sit at home, speak to me. He can save his time. He can save his money. He can, in the same time, he can do many other things. So it in a way, it is comfortable for both doctor as well as patient. And this is a significant change from pre-COVID times to the post-COVID times. And I'm sure this will continue in future also. Now that since we have got used to it, this would continue like this only. So one more question. Yeah. An anonymous user attendee is asking, is there an implication of CDSS in outpatient settings?
Oh yes, definitely. There is I think that is the thing in a standalone clinic where you are alone, because once you're in the hospital, you are surrounded by juniors and seniors, you have a team, you can get inputs. But when you are alone at the clinic in the outpatient, when you have to manage, depending on how busy, most of the clinicians are busy clinicians, they are not able to, take a decision about what to prescribe, what investigation to advise, what drug interaction is there. So it is very, very useful in outpatient. That's actually, I would say, much more a tool for an outpatient rather than inpatient, because that is a time when you're alone. You can have your own data which is available for you. You can easily publish it, or you can, even if you don't want to publish, it's a learning curve for you. You know that what you manage, how you manage the patient. Then with various kind of tools, knowledge based or AI based, they can flag you as to what kind of a investigation is to be done. Sometimes you are confused whether you want to do an MRI or a CT, which would be better. So these kind of tools can actually help you to advise what to. The only thing is you have to be sure that the tools are updated and are having the right follow the right guidelines which you follow and which your local, national, country, state follows. So that's what you need to just see that. But as far as, again, as Dr. Vikas was highlighted, drug interaction is something which is very, very important, because most of the patients are now having a whole lot of comorbid illnesses. They are living longer. They are having so many drugs. There are so many newer drugs coming in, which it is very difficult humanly for you to remember. So there are the NOACs, there are so many new antiviral drugs, antibiotics, anti-diabetics. Every nowadays, there is a new drug coming in. So it is not possible for you to remember which drug is acting at what level, because it may not concern your specialty directly. So there may be an oncology oral drug or a targeted therapy a patient may be taking, and as an ID physician or a physician, you would like to advise something. So that would become very useful there. So it is the thing for outpatient, I feel more.
Yeah, I completely agree with Dr. Atul, because it is a tool which is very, very helpful in outpatient setting. In the inpatient setting, you have time. Whereas in the outpatient setting, you have to see the patient, reach a syndromic diagnosis, think of your differentials, and then plan investigation for that patient and the treatment plan. So all that you have to do in the 5 to 10 minutes in the patient spends with you. Whereas so you have to be very quick thinking in that situation, and this is where the role of CDSS comes in, and this is very helpful in that setting. Whereas in the inpatient setting, where you have a lot of time, the time is at luxury over there. You can think, you can read, you can go back, you can recheck, and you can re-examine, you can take a rehistory. All those things you can do again and again. All that luxury is not there in the outpatient setting. You have to do everything in the 5-10 minutes which the patient is spending with you. So there is a significant amount of role of CDSS in the outpatient setting. There is no doubt in that. Coming to the last few questions of the discussion today, how can clinician and medical professionals inculcate CDSS as a habit in our day-to-day practice? This is just a forward take on the previous question, Dr. Tul.
Yeah, so it is just about a matter of getting the confidence. We need to have these kind of meetings and interaction with people who've been using CDSS, or we ourselves can use it as a pilot project in our outpatient for a fewer patients and get confidence. Because you believe it or not, but these are the way forward. There was a time when you could remember all the phone numbers which were there, but I am sure you can't remember more than 3 or 4 phone numbers right now, because no matter whatever you do, the phone book is there, you remember. So that is the way forward. There are, you used to think whether we need to do a CT scan or not, it is not, but now these are the basic norms. You have to do a scan, you have to do. So the way we have come up for digital prescriptions, most of us, or especially people who are 20 years senior to us, who are in practice, were never thought that they would be doing a digital prescription. But the pandemic and the times have taught us that these are things to stay. So similarly, CDSS is something which is the way forward, because we have to adapt technology. Technology is there, although we have to ensure that we do not become slaves of technology. At the same time, it is there to stay. So we just need to build the confidence. Maybe, as I said, use it as a pilot project in smaller group of patients. And then gradually, once we get the confidence of using it, and the usefulness we see in our day-to-day practice, then we will get the confidence that yes, these are useful. And the only thing is, as time goes on, these kind of platforms would become more widely available, more affordable, more user-friendly. So that is the way things are going to be. Yeah.
Yeah, completely agree with Dr. Atul on that. So I think we are towards the end of our discussion, and we will take one last question. Uh, Before that, we hand over to the organizers. So so Mr. Khalid is asking, we usually see CDSS as used by medical students, fellows, juniors, or mid-career doctors. Do you see value of CDSS for specialists and senior physicians?
Oh, that's the real question. I'm really happy that this question has been brought up. Very nice question. Actually, I feel they are the one who need the most. So as I am going up my career, my experience is there. I'm much more confident in managing patients, but I may not be able, everybody is not able to keep up with the pace, the way science is developing. Two things, as Dr. Vikas said, no matter which specialty, right? We are in ID every 5 years, 10 years. We may have local outbreaks. We are having Zika in one part of the country. We may have dengue in some part. That's all right. But things are evolving. Newer diseases are coming up. So nobody is an expert. All right. And drug which was used 1 year back in COVID is no longer, it's redundant now. So within a year, we have seen so much change happening. So as we are going up, specialists, we are 50, 60, 70, we have the luxury of continuing our practice till the time our brain is working. But then to give up-to-date information, the right information, the scientific information, it's an era of clinical based and evidence based medicine. So evidence keeps changing. So these tools are very, very important because younger generation people, trainees are still having the chance of going through the current data. They are more into it. But once you are up, you are busy in your practice, you may not get time. Very few people would have the interest or inclination or time to spend and have a look at the latest literature, latest articles. So it is very important for the senior people to use this tool and get abreast with the latest so as to get the right treatment for most of the patients.
So, yeah, I completely agree with Dr. Atul on that, because it is actually a tool which is much more useful for the senior people, right? Because the junior people they are much fresh, they have a little more time when you compare it with the senior fellow on hand to read and look at the latest updated scientific information. Also, what happens when you progress as a physician or as a surgeon or whatever specialty you belong to, over time you develop your experience, you develop more confidence at managing patients and difficult situations, and you develop something which I learned from my teachers called as pattern recognition. You would be very quick to recognize the pattern of diseases. These I am seeing these things, so these are the probable differentials which are in my mind. So you would become more quick at identifying the pattern of the disease, whereas on the other hand, you would your up-to-date knowledge would be going down simultaneously, because you would have lesser time to read up and look at the latest evidence which is coming up from the latest scientific journals. So this is where the role of CDSS comes in, because you would be kept updated by following these guidelines and following these platforms, whereas otherwise this would not have been possible without the digital world. Because you won't have time to read a whole paper for 2 to 3 hours from a scientific journal. Whereas if you just read 4 lines from that journal, what was the main thing which was coming out from that particular article or journal, then that is enough. And I think that is what you should be very thorough with, and you should keep updated about those kind of things. You may not be able to read the whole article or whole journal, but you should at least you should be able to read the important abstracts or important conclusions from that particular article. So that is where the role of these digital platform is very, very important. They are actually, according to me, more important for the senior persons rather than the junior persons, because they are always more keen to learn and more keen to read. Whereas the elder fellow is always busy with his or her practice, because he would have truckloads of work. There would be long queue, long list of patients waiting outside his OPD. So he would be more clinically sound, better at pattern recognition, but lesser updated is what I always say, compared to a person who has just finished his residency or a fellowship program. So it is more important for senior fellow, according to the me. I think we have, with that, we have taken all the questions, majority of the questions relevant to our discussion today. And Dr. Atul, any closing thoughts from your side?
Yeah, so I think you've highlighted most of the things, and the audience has been very, very interactive. And they have come up with really nice questions and very, very practical and pertinent questions. So all of us should now think that pandemic, COVID-19, whatever bad or thing it has done, but it has evolved us all, that we all have evolved into a much more virtual, electronic, digital world. And I think this is going to stay, because everybody has found out that this is the way forward. It is comfortable. We are having conferences. We may have been having webinars and online conferences, but the hybrid form, I think, is going to stay, where more and more people can connect and listen and get information, as people sitting right from Chennai to Srinagar to Assam, and everybody can connect in a meeting when there is a hybrid form. So similarly, everybody has understood that there is a lot of data, scientific evidence, which has to be screened and used properly. There are a lot of preprints, a lot of other papers which are there, but what is the scientific evidence? What is the class of recommendation? So platforms like CDSS would probably help us in filtering all this, making life easier for us as well as our patients, so that we can provide them with appropriate and an up-to-date scientific evidence-based therapy. And this should help all of us. So we have to see that whatever bane is there, but the boon we have to think about because of the pandemic. Thank you. It was really nice. Thank you.
Thank you, Dr. Atul. That was very nice and stimulating discussion. And it was always a pleasure to listen to your thoughts and your deep insights, not just into the scientific knowledge, but other things in life also. So with that, I would hand it over back to the organizers, and thank you from my side also.